because the healthcare reform bill has passed does not mean that people are satisfied with the bill. And as you heard Charlie say, the Washington Post has released a poll saying that 46% of Americans do approve of the changes to the healthcare bill, but there are 50% of them, of the Americans polled, do not agree with the changes made, which is a very telling divide. And it's a very interesting topic when you speak to the general public, because a lot of people may not necessarily know what exactly the healthcare bill means for them, but there's a lot of speculation, as we've heard, everything from death panels to losing your insurance to being forced to take up government brand insurance. So what I wanted to do was to, again, look at a Washington Post breakdown of what exactly the new healthcare bill would mean for you and I. So if you're an employer, how you distribute and manage your healthcare for your employees would not really change much. The majority of insured people get their coverage through their employer, which would mean that people would not be shut out from getting insurance if anything would change. Now, for individuals, this would not change as well. If you just go out and buy your own insurance, you don't get it through the government or you don't get it through your employer, nothing would really change for you, except that wherever you got your health care from would be greatly regulated. Now, Medicaid would be expanded to cover everyone with an income less than 133% of the federal poverty level, or $29,327 for a family of four. Now, Medicare, more than $500 billion will be cut from Medicare over the next decade to help fund the health care plan. And because of this, the gap in the prescription drug coverage would be closed. It is a large problem. Many Americans cannot afford their prescription drugs. So this is definitely, I think, a move to definitely help provide coverage. You know, a lot of people use and rely on a lot of different medicines, and not being able to not being able to afford the medicines that you need to keep you going from day to day is definitely a problem. Now, with exchanges, this would just mean that 50 insurance marketplaces would be administered by the states, in which small businesses and people without employer coverages can buy insurance that would meet federal standards. Now, this is from the Washington Post, and you can check it out. Just go to WashingtonPost.com and type in "how the healthcare bill affects me," and it should pop up. But there were a couple of things that I definitely wanted to point out, just to keep in mind. Definitely, this bill does not kick in overnight, especially since there's a lot of opposition and there are a lot of reforms wanting to be made. And there are a lot of things that will not kick in for a decade. And I definitely wanted someone, to definitely point that out. And that should definitely be kept in mind. But, it is a good start. Like I said, it is definitely a good start, and it's a start in the right direction. And while nothing happens overnight, again, giving more people coverage, stopping the kind of backlash against pre-existing conditions that bar so many Americans from healthcare is definitely a good thing. And, it does really start at grassroots movements, small people organizing and informing the public. And I think that was another point that he brought up, that you really need to be well informed. Not necessarily go out and read the whole bill itself, but, keep abreast of issues, maybe read the newspaper and watch what they say on TV, and, keep an ear out so that you'll understand what the bill is about.